All right. All right. Well, hello, everyone. Thank you for joining me. And hold on just a sec here. All right. All right. Well, this session is for you to answer your questions. I have been doing these on Facebook, but I decided to do one on Zoom.
All right. All right. Well, hello, everyone.
Hold on just a
Thank you
sec. It's
for joining me.
I could hear it on the background on YouTube. I don't know if you can hear that, but let me. There we go. All right, so please feel free to let me know where you're Zooming from, or if you're on YouTube, let me know where you're watching from. And yeah, and definitely start typing your questions. One thing I did want to bring up, hold on just a sec here. So again, let me know where you're Zooming from in the meantime. Let me know what questions you have. All right, so hopefully you could see this while waiting for people to enter. We could have, so we have, so Tisha from Minnesota, and then Marta is Polish but lives in the UK. How you doing? And Sarah from Maryland, Karen from Pennsylvania. All right. All right, Anita. So my next door neighbor in North Carolina. Not sure exactly where in North Carolina you are, but I'm right outside of Charlotte in Matthews, North Carolina. And so before we get into the Q&A, and again, feel free, oh, in Gastonia, cool. All right, not too far away then. So before we get into the Q&A, and again, feel free to start typing in your questions. I wanted to bring, so I have a couple of Facebook groups, and I'm sure some of you are in the Facebook group. Some of you are not. Some of you that are attending because you're not in the Facebook group, and an opportunity to get your questions answered. But in my I have a Facebook group on Graves and Hashimoto's, and then a hyperthyroid Facebook group. And in a hyperthyroid, I think it was a hyperthyroid Facebook group. What I do usually every day, at least Monday through Friday, I have like a daily theme just to get people engaging. And I spoke about BPA, plastic water bottles. I didn't specifically mention BPA, but plastic water bottles. And I assume that so pretty much the theme was, just make sure you're not drinking out of plastic water bottles on a regular basis. And I'm sure many people watching this understand why. And I took for granted, I figured that most people would understand why why they shouldn't do that. But we had a number of comments, people asking why that was the case. And all right, love when people draw on my Zoom screen. So all right, and then so I brought up a few journal articles. So bisphenol A is in plastic water bottles, and so it's an endocrine disruptor with widespread exposure, multiple effects, and here you might not be able to see this, so I'll kind of highlight it here. So although initially considered to be a weak environmental estrogen, more recent studies have demonstrated that BPA may be similar in potency to estradiol in stimulating some cellular responses. And moreover, emerging evidence suggests that BPA may influence multiple endocrine-related pathways. And again, there's plenty. I didn't bring up all the studies, but here's another one. 2000, that's from 2013, but there are some more. This one's from 2019. And then for those who ask, well, how about BPA-free products? I did write an article on that, or a blog post was a few years ago, almost 5 years ago. But still, this was based on the research, why BPA-free products might still harm your thyroid gland. And again, I'm not going to really go over it, but or at least not in detail, but there's like different structural analogs. So if it says BPA-free, then there's a good chance it has like BPAB, or I'm sorry, BPB, BPE, BPF, BPS. It could have one of those as a substitute, which seems to be just as bad. And again, this is based on research. So again, I include links to like the studies in my blog post. So I would try your best to avoid plastic water bottles on a regular basis. If it's every now and then, not a big deal. But yeah, if there's any follow-up questions, definitely let me know. But let me go ahead and stop the share. And let's go ahead and get to the chat here. And let me just double check, make sure everything is going okay on YouTube. Yep, it looks like. All right, so I'm going to go back and forth between Zoom and YouTube. But so let's see. So Sarah, we have from Canada, Alex from Massachusetts. Okay, Diane from Florida, and I'll get to your question quickly, or in a few minutes. You're one of the first questions asked. So Vassal, all right, I'm not, so someone from the UK, and then Robin from Illinois, and then Ella from Georgia County, Georgia country, not the state. Okay, and then let's just quickly see on YouTube. All right, so we have someone from Bermuda, and then Christine from Connecticut. All right, and stay in your lanes on, and Jeanette from New York. All right, good deal. So we're going to start with, we have a good amount of people both on Zoom and YouTube, which is great. All right, so let's go ahead and get into questions. So I got 2:07 my time. Definitely will go at least an hour. I'm okay going a little bit over. I can't guarantee I will get to all questions. I will try my best. But I am having, I don't have any official announcements, but I'm pretty sure I'm going to be doing a free 5-day challenge in mid-May. So I haven't announced that yet, but I'm thinking the week of May 17th. So, and when I do the challenges, they're all live streamed from Zoom to actually to my Facebook group, not to the YouTube, but to my main Facebook group. It'll be live streams, and I rotate the time, so there'll be some day calls, some nighttime calls. So there will be opportunities then, and I will, again, I'm going to try to do at least one of these per month, but sometimes it just gets a little bit crazy. So let's start with Cheryl. Actually, usually it's crazy. It's always nonstop, which is good. I'm not complaining. But anyway, so Cheryl, her question is, being hypothyroid and weight gain, how can we lose that belly fat if hormones are also low? And Cheryl is in Wellington, Florida. So I assume you mean sex hormones. I mean, if well, yeah, hypothyroid, but then you also say if hormones are also low in addition to being hypothyroid. So I would assume you're doing something for the hypothyroidism, whether it's taking thyroid hormone replacements or, I mean, yeah, there's no natural replacement for thyroid hormone, but sometimes if someone is more subclinical, they might not need to take thyroid hormone. But that's important, trying to making sure that thyroid hormone levels are at a good level, and not even if they're subclinically low, but outside of the optimal range, that could make it difficult to lose weight. And of course, we all know diet, exercise is important, but there are a lot of people that eat well and exercise regularly and still don't lose weight, and in fact gain weight. And so, yeah, I mean, sex hormones could play a role, and especially if someone has estrogen dominance. So not so much like now hormones are low. So one might say, well, I probably don't have estrogen dominance, but it's also the ratio of like estrogen to progesterone. So that's a factor. And one can have low, I don't want to get too complex. I did a call. It was live streamed in a Facebook group, but I sent out a recording. There was a call on estrogen dominance, overcoming estrogen dominance last month. And so we discussed where someone can have problems with estrogen metabolism, even if their estrogen levels are low. So you could have, you don't have to have, estrogen dominance isn't synonymous with problems with estrogen metabolism. And I also wrote some articles. If you visit my website, naturalendocrinesolutions.com, you could learn more about overcoming estrogen metabolism, estrogen metabolism problems, overcoming estrogen dominance. In your case, maybe estrogen metabolism, but there could be other factors. Inflammation is huge when it comes to difficulties losing weight. And then also having an increased toxic load. There's a book called Clean, Green, and Lean by Dr. Walter Krinian, and the whole book focuses on reducing your toxic load to help you lose weight. And then cortisol, like you mentioned. So you mentioned belly fat and problems with cortisol, especially high cortisol. There's something called pregnenolone steal, which is also known as the cortisol steal. So the body always prioritizes cortisol production at the expense of the sex hormones. So if someone has low sex hormones, it could be high cortisol. Of course, there could be other factors as one gets older and reaches, in women, menopause, postmenopause, and then men as they get older, the hormones decrease. But they also should be at a certain level. And in order to have optimal sex hormones, you want to have healthy adrenals. So if you're dealing with a lot of stress, that could also be a factor. All right, so Diane, also from Florida. Can dizziness and tinnitus be symptoms of Hashimoto's? I mean, I can't say they're common symptoms of Hashimoto's as far as dizziness and tinnitus. I did write an article on, not tinnitus, which is ringing in the ears, but I did write an article on dizziness and lightheadedness just because it's not uncommon in people with hypothyroidism, Hashimoto's, as well as hyperthyroidism, Graves' disease. But there could be other, like adrenals, problems with adrenals. I will say when I was dealing with Graves' disease, of course, you talk about Hashimoto's, but with Graves, I actually had some ringing in the ears for a few months. But even that, I can't say it's a common symptom or it's not like a classic symptom of hyperthyroidism, and certainly not Hashimoto's. Doesn't mean that people with Hashimoto's don't have tinnitus. I'm sure there's some people in this on this call, maybe in the attending through YouTube, that also has that. But again, I would look at adrenals, nutrient deficiencies, sometimes infections. Like again, I dealt with chronic Lyme a few years ago, and I can't say I experienced dizziness, but a lot of people with stealth infections, Lyme, sometimes Epstein-Barr, Bartonella, can experience those symptoms. But check out again naturalendocrinesolutions.com. Just type in dizziness and you'll come across the article. I go over a number of different factors that could be causing dizziness. And I will say with tinnitus, in some people, electromagnetic, so EMF, being sensitive to EMFs, electromagnetic fields. So just trying, and again, that's not the cause of every case of tinnitus, but it's an overlook cause. So if you've been dealing with it for quite a while, that also is something, just trying to do everything. Obviously we're all, being exposed right now as we're on our devices, as I'm doing this Q&A call. So we're probably not going to completely eliminate our exposure, but just trying your best to reduce your exposure, especially in your bedroom, and doing simple things like unplugging the Wi-Fi at night. And yeah, so, but definitely with the dizziness, check out that article, and maybe I'll write a future article on the tinnitus. All right, we have Maggie, and Maggie posted, I think it was yesterday, the day before, in the Facebook group. So I've been struggling with Graves for 15 years. My doctors have been pushing for radioactive iodine or surgery ever since I was diagnosed. I am 20 years old. I'm on 30 to 40 milligrams of methimazole. I play soccer at University of Oregon, and this past spring my hyperthyroidism was so bad I could barely run in a game for 5 minutes. Question one, I have 2 years left of soccer, but I feel the workouts 4 hours a day, 6 days a week, are running me into the ground. I know there is no easy way to fix, but besides diet and detoxifying, what else could I be doing? I mean, the basics are really important. So you could consider doing things like, taking amino acid supplements and things, but diet, of course, diet's going to be important. And I do stress for many people with with these conditions, with thyroid, autoimmune thyroid conditions, to follow a lower carbohydrate diet, not necessarily a ketogenic diet, which is really low carb, but it might be a different story for athletes. So you want to make sure, like, again, some athletes, actually a lot of athletes do better with not loading up on carbs like pasta, for example, but just eating, making sure you're getting sufficient healthier carbohydrates. And again, that's an article in the making as well that I need to hopefully sooner than later. But of course, sleep. So yeah, I wish I could say, like you said, there's not really a quick fix. But just making sure, eating. I mean, because that's 4 hours a day. I mean, that's for practice, the 4 hour day workout, 6 days a week. And again, if for someone who's in a healthy state, it might not be a big deal. But for someone who is dealing with hyperthyroidism, I wish I could say there's, just, take these supplements and everything will be fine. But yeah, I guess, see if there's anything you can do about reducing the workload, which I know might not be an option. But yeah, definitely keep up with the diet and yeah, I mean, detoxifying, but also sleep, making sure you're getting, of course, sufficient sleep. In your case, definitely getting, at least 8 hours of sleep. Trying to do your best to, manage stress as well, blocking out time for stress management. And you are getting married this July. Congratulations. So my doctor mentioned that methimazole is not something you can take while pregnant. Not that I'm planning on it yet, but this was my doctor's biggest reason for pushing me to do radioactive iodine, safer alternatives. So yeah, this is a little bit of a dilemma with those who are pregnant, because I've worked with women who are pregnant with hyperthyroidism. And you're not, like, I took bugleweed when I was dealing with Graves, and a lot of my patients take the herbs, but they're contraindicated during pregnancy. So typically the first trimester, I will give PTU, which instead of methimazole. So again, I know a lot of women understandably don't want to take antithyroid medication. But everything's risk versus benefits. As you said, it sounds like you're not planning on it right now. So hopefully by the time you do get pregnant in the future, hopefully you'll be at the point where you're off the medication. But yeah, I wish there was, like what in the past I tried, so there's some are concerned about cruciferous vegetables like goitrogenic foods, which inhibit thyroid activity. And so I experimented years ago, healthy experiments. So I hate to use that word, especially when talking about pregnant women, but just having them eat larger amounts of cruciferous vegetables, see if that helps to lower the thyroid hormone levels, and really no luck with that. So yeah, and again, bugleweed is there's really no research. It's not that it's been proven to be harmful. There's just no research with bugleweed and pregnancy, and again, motherwort isn't really affecting the thyroid hormone levels. You want things to lower the thyroid hormone levels, not just things to manage the cardiovascular symptoms. And L-carnitine, lower doses of that might not be a big deal, but the research shows you need higher doses, like 2 to 4 grams per day. And again, there's no research showing that that's safe during pregnancy. So again, unfortunately, with most women who are pregnant, they're usually taking the PTU, which again, I mean, not everybody does bad with the PTU. It's methimazole is given over PTU because in the research, PTU shows that it could put more stress on the liver, but that's not the case with everybody. And again, everything does come down to risk versus benefits. All right, so let's, and I will get to my YouTuber soon. Just gonna spend a few more minutes on Zoom and then kind of go back and forth, as I said. Okay, so Marta, can one suffer from both Graves and Hashimoto's at the same time? If yes, how would it manifest itself? So it is common for people to have the antibodies for Graves and Hashimoto's. I do see this quite frequently. And I wrote an article not too long ago on, I forgot the name, but like just being hypo and hyper. Now you can't be hypo and or going back and forth between hypothyroidism and hyperthyroidism. So you can't be, if you're hypo, you're hypo, you're hyper, you're hyper. But but you can fluctuate back and forth between the two. So if someone has Graves and Hashimoto's, how does it manifest itself? I mean, symptom-wise, it depends. Some people are dominantly hyperthyroid. Some people do kind of fluctuate between hyper and hypo. And, what you need to keep in mind, of course, they're both autoimmune conditions. So when it comes to the autoimmune component, there's a lot of overlap in how to address Graves and Hashimoto's. If someone's predominantly hyperthyroid, then they would take either antithyroid medication or antithyroid herbs, such again, bugleweed, as I mentioned earlier. If someone is predominantly hypothyroid, then again, they might take thyroid hormone replacement, depending on how low the thyroid hormone levels are. If someone's fluctuating back and forth, like there's a hashitoxicosis, which is Hashimoto's, but transient bouts of hyperthyroidism, that makes it more challenging. The person usually won't be put on antithyroid meds unless if they're misdiagnosed as having Graves, which sometimes does happen. So frequently from a conventional standpoint, they'll be put on beta blockers. And from a natural standpoint, maybe something like motherwort, even though I'm not completely opposed to putting someone on bugleweed. It depends how some people, it's when I say transient, they might be hyper for a few weeks or a few months. The challenge is you never know when they're going to go back to hypo. So if you put someone on an herb such as bugleweed, or if someone were to take a medication like methimazole or PTU or carbimazole, then if the person became hypo, they would become really hypo being on the antithyroid medication. But ultimately, again, the goal is to address the autoimmune component. All right, so private message. So when I get a private message in Zoom, I'll try to remember not, some people I think just do it accidentally, not meaning it to be private, but I'm sure some people also want it to be private. So I'm gonna try my best. I'm so used to calling out names, but I will try to remember to not call out the name if it's private. So, but I'll read out the question so everybody could benefit from the question. So if the thyroid sustains damage from a stream of autoimmune antibodies and begins to feel pain and so on, are there any foods or supplements that will help facilitate healing? I don't mean healing of the autoimmunity generally, but the thyroid tissue specifically. Thank you. So yeah, I wouldn't say there's one type of food or so yeah, I would I will say, and again, I'm not trying to say that everybody needs to do this, but there is some of you might be familiar, there's a supplement, thyrotropin PMG, which actually minimizes the damage to the thyroid glands. So it helps to slow down the progression. But as far as helping to, I will say the thyroid, it can regenerate, but it takes long, like it's not like the liver or the gut, but it definitely can regenerate, and because some sources say that it cannot. And I would just make sure you're eating, healthy protein, healthy fats, just healthy whole foods. But I can't say there's like specific foods. I have written articles like power foods, but even those like avocados, things I can't say they're like specific for like helping, the thyroid gland regenerate specifically. Another private message. Is it expected that someone with Hashimoto's will likely need to take supplements forever? I have a fairly severe sensitivity to gluten also. So I don't know if you mean thyroid hormone forever, or if you mean thyroid hormone, some people will, some people won't. As far as supplements forever, I mean, I will say that, I've been in remission from Graves since 2009. And, I've been taking, I haven't taken bugleweed since then, but I have taken supplements, and I plan on taking, like I take certain supplements like a probiotic and omega-3 and, some others. I probably take more than most people. So I'm not suggesting you need to take everything I take, but But yeah, so if you're talking about supplements, I mean, you might not need to, if you eat whole healthy foods, organic most of the time. Even then, I mean, because I do that most of the time, and still the soil, it's just not the same as it was years ago. The food just aren't as nutrient dense. So not saying that everybody, and again, it also depends on what you do. Like, I don't eat a lot of fish, which is why I take an omega-3 fatty acid. So it really does depend on your diet. And I hate to say that people absolutely need to take supplements forever. um, but sometimes that is the case. And like I said, in my case, it's to me, I don't, I'm not too concerned. Again, if someone, we're not talking about like, having to take like 15, 20, 30 supplements, like, like, yeah, so that's, but yeah, some basics, like, again, if you're not like magnesium, I think it's important. And you might be able to get enough eating whole healthy foods. I also say once you correct deficiencies, it's easier to maintain it through eating a whole healthy diet. um, but again, it all depends. Are you eating, whole foods just about all the time, organic? And you also have a fairly severe sensitivity to gluten. So obviously, yeah, you want to try everything you can to avoid gluten. All right, so Tisha was hypothyroid in the past, euthyroid for 5 years, and now hyperthyroid. So euthyroid, for those who don't know, that's like just normal thyroid hormone levels. How likely is it that I will be euthyroid or hypo again? So for 5 years, you've been hyper. So if you have, I mean, the goal is that hopefully you will be euthyroid again. So, that depends on addressing the cause of the problem. If you have the antibodies, we were talking earlier about this situation where some people have the antibodies for Graves and Hashimoto's. And, so if you have the antibodies for Graves and you're presenting with hyperthyroidism, but you also have the antibodies for Hashimoto's, in the future, if nothing's done to address the immune system, you very well might become hypo again. So, but again, the goal is to try to address the cause of the problem, address the autoimmune component. And if it's something else, like if you have toxic multinodular goiter, as far as becoming hypo, I mean, if some people have toxic multinodular goiter and they have antibodies for Hashimoto, so that would be a situation where you might become hypo, hypo again. But again, there's no way to predict. So I know you're not asking, will I definitely become euthyroid or hypo, but how likely? And it really depends if you have, and unfortunately that answers for a lot of different questions. But if you have antibodies for Graves and Hashimoto's, and if the autoimmune response isn't addressed, there is a greater likelihood that eventually you'll become hypo. And it might not happen. And if it does happen, it could be like another 5, 10, 15 years. I mean, it could be next week also. But again, obviously, euthyroid would be the goal, to try to address the cause of the hyperthyroidism. If it's Graves, or toxic multinodular goiter, goal is, I mean, it could be subacute thyroiditis, but if you've been hyper for 5 years, it's probably not that. So I'm thinking more Graves or toxic multinodular goiter if it's been for that long. All right, so I'm going to get to this question, then I'm going to go to the YouTube channel and answer a few questions. So again, this is private. So will you please share with us what your labs were when you started to treat your Graves' disease? Just wondering if it was moderate, mild, moderate, or severe case. Yeah, I wouldn't say it was severe. I didn't have the TRAB. I had the TSI. So TSI for, again, I had Graves' disease, 2008 is when I was diagnosed. And so my thyroid stimulating immunoglobulins, that's a type of TRAB, a type of TSH receptor antibody. And, so I'd say mine was moderate. Mine was like in the, kind of like the mid 250s. And I see a lot of people like over 300, and, I had like someone yesterday who was, I think, around like 450. And, I've seen people higher than that. And, so anything like over 300 starts getting more, severe. So I wouldn't say, I wouldn't say mine was mild, and my thyroid hormone levels definitely were elevated. Um, they weren't mild. My symptoms, I was hyper, and I had palpitations, and lost 42 pounds. I lost a lot of weight when I was dealing with hyperthyroidism, and yeah, so I would say my case was more in the middle. Not, I mean, I will say this: the severity when it comes to like Graves. Um, a big concern when the antibodies get when the higher they get, the more likely someone is to have thyroid eye disease. And I will say, speak of thyroid eye disease, next week, this will be back on Facebook. I'm having an interview with an ophthalmologist who we're going to talk about taking an alternative approach to thyroid eye disease. If you're not on Facebook, I will send the recording. But what I tell people, if you want to, you could always create a temporary account on Facebook just if you want to join. And, but if not, I will send out the recording, and that will be next Friday, April 30th at 2 p.m. Okay, let me go to YouTube here and see what questions people have here. All right, so how likely is it to go into remission, especially if I've been hypothyroid and euthyroid the past 10 years? Okay, I think you asked actually, so you must be on both Zoom and YouTube. That's one thing I'm also going to try to do. It's going to be hard to remember everyone, but I'm going to try not to try to get to as many people. So I might not answer multiple questions, but again, I'll briefly say the duration for hypothyroid, if there's been a lot of damage to the thyroid gland, it also depends if someone's hypo. I think you said you're hyper now, but if someone's hypo and if they're taking large amounts of thyroid hormone replacements, then that usually means that there's more damage that has been sustained to the thyroid gland, and it might be more difficult to get off a thyroid hormone. But that doesn't mean that for someone with Hashimoto's, just because even if someone can't get off of thyroid hormone, doesn't mean that you can't get the immune system back in a healthy state. And same thing with Graves. With Graves, you're not really getting damage to the thyroid. So if someone has had Graves for 5-10 years, and even though a lot of doctors won't let them stay on antithyroid medication for that long, but if someone happened to be on, let's say, methimazole for 5 years or 10 years, doesn't mean it's going to be more difficult for them to get into remission just because they've been hyper for that long. Because again, no damage has been sustained. So the goal in the case of both Graves, Hashimoto's, again, find the triggers, correct the underlying imbalances, address that autoimmune component, which is easier said than done. Admittedly, it can be a challenge in many people. So Carol here asks, is there any likelihood one can shrink a goiter with natural treatment methods? It is possible. It depends on how big the goiter is. So I did have a mild goiter when I was dealing with Graves' disease, and I had problems swallowing certain things, like, for example, fish oil supplements. When I took them, sometimes, not every time, but sometimes they would kind of get lodged in my throat, which was really scary. But yeah, that definitely resolved. And yeah, so I did write an article. Again, I refer people to articles just because they're more in greater depth than what I could say here. So there was an article on thyroid swelling. Like if you visit my website, naturalendocrinesolutions.com, and just do a search for thyroid swelling. And also I have some articles on goiters. I've written a few articles on goiter. Thyroid swelling, same. I mean, that's essentially a goiter. So the name of the blog post, the headline had thyroid swelling instead of goiter. So, but yeah, you just need to address like if it's hyperthyroidism, you want to, of course, balance the thyroid hormone levels. If it's problems with estrogen metabolism and insulin resistance can also be factors. And if someone has a really large goiter, though, in that case, it can be difficult and might not get back to normal. So I don't want to say that all goiters can normalize. It really depends on the severity. Okay, someone is asking, can you suggest medical advice? I can send my report. Only to my patients. Yeah, I cannot, also this isn't really like there's, this is the goal here is to try to, you know, um, try to get through questions real quickly. So if I were to look like look at people's reports and all that, then it would be very time consuming. But that aside, I wouldn't be able to say like, look at a report and say, this is specifically what you should do. I can only do that for my patients. I could give, general suggestions here. So, yeah, so we have Annette here that asked my RT3, which is reverse T3. My reverse T3 is all over the map. Last week it tested 25.3, which is pretty high. My naturopathic doctor upped my T3 and added iodine. I'm on 75 micrograms of levothyroxine and 2.5 of the synthetic T3. Your thoughts? I live in Wisconsin. All right, so yeah, I made a trip to went to Wisconsin Dells a few years ago. Actually, been to a few different parts of Wisconsin, but yeah. So reverse T3. If there's so you always want to try to address the if you have a problem converting. You might have both low T3 and T4, but a lot of times when now reverse T3, I will say with hyperthyroidism, it's commonly high. So what I'm about to say doesn't necessarily apply to cases of hyperthyroidism, but if someone's dealing with hypothyroidism, Hashimoto's, and the reverse T3 is high, then many times there's a problem converting T4 into T3. And so, taking T3 will help with the low T3. It's not doing anything for the cause of the problem. So what I would say, and it's not to say that you shouldn't take it, but while you're taking it, you want to try to address liver. So approximately 60% of conversion of T4 to T3 takes place in the liver, and approximately 20% of that conversion takes place in the gut. So liver and gut are extremely important. And then adrenals, if someone has especially high cortisol, can affect the conversion of T4 to T3. Inflammation could also, so there's a lot of factors. And I've, not a surprise, I've written an article on conversion problems, which again, you could find on my website, naturalendocrinesolutions.com. So yeah, so I would again focus, and I also wrote about reverse T3 as well, but that's again, just so check out reverse T3 article as well as conversion, problems with conversion. All right, so Jeanette, are you familiar with Anthony William, the medical medium? Anthony Williams' take on thyroid disorders, as he feels that if it's from the Epstein-Barr virus, hiding it in the thyroid. If so, what's your take on it? Yeah, I did. A few years ago, I guess it wasn't right after his books came out. It was really just patients kept on asking me, or just not just patients, but just people in general just kept on saying, did you read Medical Medium's book? And so I did. I read. I guess it was his original book, and then he came out with one on thyroid healing, and I read it just just to be aware of what when others ask me questions, and so Epstein-Barr can be a factor. Now, I know he says that it's like, but it's behind 95% of thyroid conditions, including Graves, Hashimoto's. So I don't think that's the case, but I do think it is a factor, and so I do recommend testing for Epstein-Barr. And I've written some articles on Epstein-Barr, and then in September of last year, 2020, I did an interview with Dr. Kashik Hines, who is author of the book Epstein-Barr Virus Solution, and it's actually on my YouTube channel. So those who you're on YouTube, this question is from YouTube, so you could check it out. And for those not tuning in on YouTube, you can just visit my channel, Natural Thyroid Doctor. Just do a search, and then you'll see my interview with Dr. Kashik Hines. So we talk about Epstein-Barr, and we talk a little bit, I believe, about, actually, I'm not sure if we spoke about medical medium. I know she brings it up in her book, and I think we did bring it up, but I'm not sure. So, so she's not opposed to what he says. And, a lot of what he recommends also is just, eating whole healthy foods. And, he does give some supplement recommendations. I know celery juice is a big staple of what he recommends as well. But as far as like Epstein-Barr being the main culprits, yeah, I can't say that I agree that in like 95% of people that is the case, but it's a big enough factor where, I do like to test for it. Now, that being said, also keep in mind most people have Epstein-Barr, so it doesn't mean it's causing problems in everybody. And when it is causing problems, I look at it more of an immune system problem than a virus problem. I will sometimes I will sometimes give recommendations to treat the virus, but if there's anything dragging down the immune system, including chronic stress, that can make you more susceptible to um, to uh, the effects of Epstein-Barr. All right, so I'll answer a few more questions on YouTube, and then we'll get back to Zoom. So I'm wondering about, okay, so I knew this was going to, was waiting for this question. So I'm wondering I'm wondering about the safety of COVID vaccine for someone with Hashimoto's. I'm concerned because I started having symptoms, was diagnosed with Hashimoto's right after having flu shot a few years ago. Yeah, so I'm not going to get into great detail. Just there's, so much division over, this last year with everything involving COVID and, so I will say that we don't know 100%, when it comes to the vaccine and the safety for autoimmunity. So I will say that, it's still early. I personally have not had the vaccine, so I will say that. But I've had patients, and I have a history of Graves, even though I've been in remission. So it's also will be interesting to see what others, who might be in remission and they get the vaccine, but then also people who are currently, dealing with Hashimoto's or Graves or even other autoimmune conditions. So far it's very early. So I've had a few patients, early on, it does the short-term side effects, from what I've seen, don't seem too bad. But the problem is, it's again small. In my case, small sample size, because I haven't seen yet like hundreds. Even I can't say I've seen dozens of patients who have gone through both vaccines so far. And I'm sure as the months go by, I'll see more and more who have done that. But so, and then also the long term, we don't know the long term. So I am attending a conference next month, hosted by naturopaths, and they're going to be talking about potential impact of the vaccine on the immune system and those with autoimmune conditions. I'm hoping that they'll also bring up some of their patient experiences as well, what they've seen. But I can't. I will say I've had one patient who got, and this was a patient not with Hashimoto's but with Graves, who got I think it was the Moderna vaccine, got both doses, and then 10 days I think after the second dose, she felt like she was relapsing. Now, was it due to the vaccine? She thinks it was, and she's not against vaccine. She's actually was, in favor. Like, again, not getting it out of just fear, but getting it. She's, not again, not against. Anyway, I'll just say she's like, not biased against vaccines, but she thought that it was due to the vaccine because nothing else changed. And I think I saw in the Facebook group maybe a few others like mentioning, but then I've seen others get it without seemingly having a problem. So I think it still is too early. I mean, feel free. I don't know if we'll get to anybody or like who does this, but if someone, if anybody here attending has gotten the vaccine and you feel like it has worsened your condition, let us know. Or the opposite, if you have gotten it and you had like follow-up testing, like your antibodies, you had like antibody testing before the vaccine and then antibodies after the vaccines, and and it seemed like there was no negative effects, so again, not just how you feel, but those are things that I'll be looking for, over the next few months. And so I guess stay tuned. But yeah, because as you can imagine, I get that question a lot. Not only from like calls like this, but yeah, my patients as well. So all right, let's go. All right, let's give okay, these, and actually someone else asked Roseanne, thoughts on COVID vaccine with Graves, any concerns? I hear concerns a vaccine can cause autoimmune due to overactive immune system. Like I said, it's still there's a lot unknown is what I'll say. So there's, yeah. But all right, so Christine, I'm gonna answer these two quick, there's two questions here. There's more than two, but I'll get to these two. Then I'm gonna go back to Zoom, and then I should be able to go back to YouTube at least one more time. But so Christine says 5 micrograms of Cytomel with my Synthroid and my weight started falling off. Cytomel made all the difference with my Hashimoto's. It took 3 endocrinologists to get it prescribed. Yeah, so I've mentioned, you're responding to one of the first questions I had where someone losing weight. And yeah, if someone, that, like I said, with the thyroid hormone being low, and again, if someone's subclinical, like a lot of times, a few things. One, some doctors just look at T4. So Christine brings up a good point here. And we had someone else who, I was bringing up a question where she was taking, T4 and T3, and with the one with the elevated reverse T3. So some doctors, all they do is test for TSH and the T4, total T4 or free T4. But either way, they're not looking at free T3. And then another thing, some doctors look at it, but if it's within the lab range, then they figure it's not a problem. But someone could be on the low end of the lab range, and that could cause problems with losing weight. That might make it more difficult to lose weight. So, the 5 micrograms of Cytomel, that's not fixing like if someone has, like I mentioned, a conversion problem, that's not fixing the problem. But again, if someone has really low free T3 levels, T3 is the active form of thyroid hormone. On a temporary basis, you might need to take something to increase that. She said it took 3 endocrinologists to get it prescribed. A lot of endocrinologists don't prescribe T3. And then, so this next person asked, can T3 levels be raised naturally? And so yes, so I mentioned conversion problems. But if there's not a conversion problem with if T4, T3 is low, let's say someone has Hashimoto's, immune system damaging the thyroid gland, causing T4, T3 to be low, then you want to address that autoimmune component. So in that case, you would address the immune system. And in the case of a conversion problem with T4 to T3, conversion problem with T3 being low, liver, gut, adrenals would be the top 3. Other factors being, again, inflammation, and then inflammation, also selenium. If someone has a severe selenium deficiency, that could also affect conversion. So let's go back to Zoom. And let me just take a quick sip of water here. All right, so wow, we have a lot more questions than I thought we'd have. So again, I apologize for advance. Like I said, I'm gonna go. I blocked out an hour, but definitely gonna go up longer than an hour. But I'm probably not gonna get to. I'll go. What I'll do, I'll go to 3:30. I was gonna go to like 3:15, so I'll go to 3:30. And then again, I might do another one of these before the challenge, assuming I haven't officially announced a challenge, but I'm like 80% sure I'm going to do an accelerated thyroid healing challenge in mid-May. So there'll be a lot of opportunity for questions then. And again, that'll be Zoom, also be on Zoom as well. So, so Sarah says to Marta, yes, my doctor said I have both types of antibodies, again, Graves and Hashimoto's, but for me, I am mainly hyper and may be different for others. Yep, that is true. Okay, and then yeah, someone with the BPA, I think she said, I saw the post and was really shocked that people don't know why. So again, why you shouldn't drink out of plastic water bottles. And like I said, I really wasn't going to bring that up here during the call, but when I saw how many people were just asking why, like, there was a bunch of people who just kept on asking why avoid plastic water bottles. I was like, well, I'll just address it here. And then what I'll probably do is just send that video or send this video, the recording, posted in the face under that post so people could see the studies that I covered the first few minutes of this call. So Alex here says my TSH is 0.01, free T4 2.4, free T3 7.6, thyroid globulin 27, thyroid peroxidase antibody 737, and I want to get pregnant. What do I do? I've been on plant paradox diet, grass-fed meat, organic vegetables, and fruit only as well for 1 month. So so diet-wise, I mean, again, it sounds like you're doing a good job with the diet. Just keep in mind, diet is one component. So let's see, it was February. I actually had a challenge then, a hyperthyroid healing diet challenge, and maybe you attended that. But so diet's important, but many times just cleaning up your diet won't address the underlying cause. So if you're eating well and you're still hyperthyroid, and you still have the TPO antibodies. I'm not sure if you had the Graves, since you're hyper. I don't know if you also looked at the thyroid stimulating immunoglobulins, the TSI, to see if you have Graves. But either way, if it's Graves or if it's Hashimoto's, then addressing the immune system. So there could be different triggers. So one is food. So there's four main categories of triggers. One is food, two is stress, three chemical, four infections. And so before you get pregnant, especially those last two, especially chemicals. I mean, once you're pregnant, you're not going to want to do anything to reduce, there's not that you can't do anything, but really need to be cautious about detoxifying and reducing the toxic load. So you want to do as much as you can right now. And then even like if you had like some type of infection, like H. pylori or, a parasite, for example, if you are any type of antimicrobial protocol, again, there might be some limitations when pregnant. So I would try to do what you can to remove the trigger. Again, visit my website, naturalendocrinesolutions.com. And then again, be on the lookout for the free 5-day challenge that I think I'm going to have. So like I said, I'm pretty sure I'm going to have it. It's just it's been overwhelming. I've been trying to come out with a podcast for like so long and been like trying to prioritize that. And I'm like, if I do the challenge, I want to do the challenge, but it's going to push me back a little bit with a podcast. But I like, ever since last year, I like to do challenges every now and then. So I've did a few 21 longer ones last year, but just definitely don't have the time for that right now. But anyway, so 5-day challenge, check that out next month, but also check out some of the articles on my website, naturalendocrinesolutions.com. All right, so Anita, what tests are done to distinguish between Graves' disease versus thyroiditis with autoimmune aspects? So, I mean, so thyroiditis, if you talk about subacute thyroiditis, so thyroid stimulating immunoglobulins, if you're hyper and you have the positive TSI, or you could do TRAB, TSH receptor antibodies, but TSI is a little bit more specific. So if someone has hyperthyroidism in the presence of positive TSI, then it is Graves. It is diagnostic for Graves. If someone has hyperthyroidism and they don't have those antibodies, then it might be thyroiditis. There's also toxic multinodular goiter, but if someone does an ultrasound and they don't have any nodules, then it's probably not that. And I mean, some people can have, like you said, with autoimmune aspects. I mean, so some people will have subacute thyroiditis, and they might have like positive like TPO antibodies, but there's also Hashimoto's, which again, that's so that subacute thyroiditis usually is typically the person will be hyper for a few months and then will become hypo and then will become euthyroid, but it'll be brief. So it's not going to be like someone mentioned earlier where they were like have been hyper for 5 years, and that's what I was saying. That's probably not subacute thyroiditis. If it's only a few months, and then the person becomes hypo, then it might be subacute thyroiditis. It could be Hashimoto's, though, if you have the autoimmune aspects, meaning positive TPO antibodies and or anti-thyroid globulin antibodies. All right, so Ella, I am using motherwort and bugleweed for 10 days now, 3 times a day, 30 drops. My heart rate is still high. Shall I wait for the improvement of rate or add propranolol? Yeah, and this is where again I'm limited because I can't really, I can't like tell you like not to, like I hate to say don't take the beta blocker propranolol. Many of you probably know it's a beta blocker, so I don't want to say, if you have a really high heart rate, you want to be safe. So propranolol is more. Now there could be a few reasons why the motherwort and bugleweed's not working. It could be a lower potency. It could be the dosage is not enough, as well. So, if someone's taking like herb farm, motherwort, and bugleweed, then 30 drops really isn't a lot. Um, but again, it could not, it doesn't, they don't work for everyone as well. So you might need to take the beta blocker. So again, risk versus benefits, and it's hard to, when my patients, of course, like look at blood tests, and even in patients' case, I never will say like, like take, if it's recommended, like if someone was recommended like to take methimazole and or, antithyroid medication and or beta blockers, and they want my opinion, I would never like tell them to get off the meds, but if it was recommended and things are severe, then I might say, well, it might be a good idea to, even though you don't want to be on the meds, but to temporarily, if I, so, but again, I'm very, very, even with patients, I'm very cautious, but, with someone who's not a patient, again, just, definitely use, just use your judgment. If if your resting heart rate is, 90s or higher, I mean, even 80s is kind of high, but once it gets into the 90s and definitely triple digits, it's yeah, I'd be nervous, but like I said, it might be that the bugleweed and motherwort just lower potency and or not the dosage isn't high enough, um, but that might not be the case as well. So it's yeah. So let's see again. Just trying to remember who I answered and who I didn't. Okay, so yeah, I had someone who had the repeat question, so I'm going to let's see, and we have someone else from the UK using their iPad. Okay, so Diane, I will say you asked, is it possible to keep Hashimoto's in remission, avoid destroying your thyroid and becoming hypo? Yes, it is. It is possible. You might want to check out my book, Hashimoto's Triggers. So that's very comprehensive. You don't necessarily have to read it from front to back, but if you remove the triggers, correct the underlying imbalances, then it is possible. All right, and Karen, does anyone have a remedy that stops profuse sweating while your thyroid levels are being adjusted? So again, I'm not sure. I mean, if you're hyper, then not everybody with hyper experiences profuse sweating, but it is more common for people with hyperthyroidism to have, profuse sweating, heat intolerance, and really, and when that is the case, you do want to lower those thyroid hormone levels. So, if it's due to hormonal, like things like adrenals, working on health of adrenals can make a big deal. But yeah, if it's due to the hyperthyroidism, which I'm guessing is the case with you, and if in working on just lowering and balancing those thyroid hormone levels, then yeah, that very well might take time. And if you're taking, again, I don't know anything like what you're taking to bat. Like, are you taking the antithyroid medication? Or are you taking the bugleweed? If you're taking bugleweed, that might take, probably will take longer than antithyroid medication. So not to say to take antithyroid meds, but if it's really uncomfortable, again, just also keep in mind what I said earlier. There's different potencies with the bugleweed. Like Herb Farm or I mentioned Herb Farm because it's a common brand, which is good quality but lower potency. It's a 1-to-5 extract. And usually I recommend like a 1-to-2 extract. Okay, and Anita, can you read the question before you answer? Yeah, I think I think you asked this before I started answering the questions. Yeah, definitely. So always read the question. That's one thing I will say. I like really, I don't like Facebook. I don't do Facebook live. Like I don't do that because I like Facebook, but I use StreamYard. I can't use StreamYard with Zoom. And I love StreamYard because I could post the question for, so like if someone has comments, I could just display it. So I still read it out loud, but everybody could see the question. So here, I mean, you could see the question in the chat if you're on Zoom, but then you have to like kind of search for the question. All right, and Helen is from that was the one from the UK, and then we have Linda from Toronto. Okay, and like I said, I'm trying to get to. All right, are breakouts, pimples, acne on the jawline and neck an indicator of thyroid issues, or could it be something else? No, very well. It could be something else. Like it could be, too much dairy, for example. But I wrote an article also on acne, just because it could be related to the immune system. Assuming you have an autoimmune thyroid condition, and if it's just thyroid related, non-autoimmune, then maybe not. But if you have Graves or Hashimoto's, it could be a factor. So definitely visit my website, naturalendocrinesolutions.com, do a search for acne. All right, so this person says, I have a small nodule in the front of the neck. Not visited GP as yet, don't want radioactive iodine. What are alternatives to this? So again, I've written a number of different articles, blog posts on nodules. So some of the more common causes of nodules, problems with estrogen metabolism. And again, this is according to the research. This isn't just it's also my observation, but also it's in the research. That's how I started focusing on problems with estrogen metabolism. And we spoke about that during the interview I had with Magdalena last month on overcoming estrogen dominance. But again, it's even if you don't have elevated estrogen levels, but you have problems with estrogen metabolism. And there's a test, dried urine testing, the Dutch test, that unfortunately there's not a lot of tests that look at estrogen metabolism, but that's one of the tests. And insulin resistance. So I wrote an article, insulin resistant and its effects on thyroid nodules. And and the reason I wrote that is because again, that's in the research. So I referenced the journal articles. So Carlos, recommendations before getting pregnant with hypothyroidism. So, I mean, of course, trying to balance, making sure the thyroid hormone levels are in balance. I mean, if you have to take thyroid hormone, definitely I would everything's risk versus benefit. So there are some people that if you're overtly hypo or your levels are on the lower side of optimal, and you get in pregnant, obviously you want to try to address the cause of the problem, but you might need to take thyroid hormone, and you might already be doing that. But detox, I mentioned earlier, you want to do everything you can to reduce your toxic load, to do things to detoxify, because once someone is pregnant, they can't do that. All right, so Gretchen here says, my thyroid disease tends to cause a toxic level buildup. Toxic level of buildup of estrogen. To prevent this, I take DIM daily, but DIM is made from concentrated cruciferous vegetable material, which is detrimental to thyroid. And that's, like I was saying earlier, that is not true. So cruciferous vegetables, some are concerned about the goitrogenic effects, but that is not the case with most people. There's always going to be exceptions to the rule. And again, I wrote a blog post a number of years ago on goitrogens, and I told you about my experiment with goitrogens. But again, everybody's different. So, and actually this person might be one of the exceptions. She says, since starting the DIM, my thyroid has become slightly enlarged for the first time in my life, and my antithyroid TPO is elevated. Is there anything that can be done about this? So I will say, again, most people, and again, DIM isn't the same as eating cruciferous vegetables. So I don't remember. I've had a number of people on DIM. I can't say I've had people with the same side effect, but everyone's different. So you want to listen to your body. And what I would say is you could also do a lot by eating broccoli sprouts, which again, it's still cruciferous, but maybe taking that, because DIM is pretty concentrated. Like I said, I don't recall anybody having a goiter, even though you said it's slightly enlarged, but still, even slightly enlarged, if that's the case and you're pretty sure it's due to the DIM, I would listen to your body, maybe consider broccoli sprouts instead. There's also calcium deglucarate, which, can help with estrogen metabolism as well. DIM is more commonly recommended. But again, maybe broccoli sprouts. All right, so CJ, I have no antibodies, but am hypothyroid. Plan of action to lower TSH, raise T3 and T4 without meds. Well, you still want to address the cause of the problem. So you want to, you might not need to like do autoimmune paleo if you don't have Hashimoto's. Although keep in mind that sometimes there could be false negatives with the antibodies. So I wouldn't rely on a single reading. But what was I going to say? Yeah, so diet-wise, still avoid common allergens, especially gluten, dairy, corn, and then certain toxins like mercury can bind to thyroid hormone. Even if someone doesn't have autoimmune, it can potentially cause hypothyroidism. So making sure if you have any mercury amalgams, maybe consult with a biological dentist about getting them removed, because they take the proper precautions. And if not, then other sources like certain type of fish. I mean, all fish will have mercury, but some like tuna, swordfish, king mackerel will be higher amounts of mercury. And so those are probably the two big areas. I mean, again, Epstein-Barr potentially, even though I think it's more closely associated with Graves, Hashimoto's, so autoimmunity, but possibly with non-autoimmune conditions as well. All right, so Carol, as an attempt to lower my TSH, my practitioner's newest order is to only take levothyroxine 6 days a week. Is there any adverse reaction to skipping 1 day a week? Yeah, I mean, if someone, I guess it might not be the end of the world, but if your TSH, I don't understand, like you're mentioning your TSH, it sounds like it's high. So as an attempt to lower your TSH, so it's only is taking levothyroxine, but only 6 days a week. Yeah, I mean, you might need it the 7 days a week. I guess it depends on how high it is and what do the thyroid hormone levels look like. So yeah, it's not common for someone to just say, the practitioner to say take it 6 days and skip. Yeah, I don't know the reason for the practitioner recommending to only to skip that single day. All right, I'm going to get back to YouTube, and then I'll get back to YouTube one more time, and then get back to Zoom one more time. I'm going to first answer this question. So struggling with Hashimoto's, 5 years in, traumatic trigger, and struggling to get thyroid levels optimal, menopause onset at the same time, have been on levothyroxine many years, liver struggling and don't detox. How can I get my liver healthier? Cannot use milk thistle. So try to do as much as you can through diet. So cruciferous vegetables, and again, most people do okay with cruciferous vegetables, but things to help with glutathione. So you could, like people, like with my patients, I might tell them to take something such as NAC, N-acetylcysteine, which converts into glutathione, or maybe I will tell them to specifically take glutathione, like a acetylated or liposomal glutathione supplements, and just try to do as much through diet, as many vegetables as you can, especially diverse, as long as you could tolerate. If you have something like SIBO, you might have to address that first. But yeah, and then sauna too. Just want to do things to reduce your toxic load. Not so it's an infrared sauna. It's just sweating out the toxins. Can make a huge difference. Okay, and here's a quick question here by Linda, and then we'll get to YouTube. Why does the medical profession not test vitamin D levels on the autoimmune patients? And your guess is as good as mine. I think everybody should test. Yeah, I really think everybody, not just those with autoimmune conditions, but everybody should get tested for vitamin D. So if you have family members who have never tested for vitamin D, I think it's a good idea because there's a good chance they'll be deficient in vitamin D, and it could make them more susceptible to an autoimmune condition or other health conditions. So let's go back to YouTube one more time. And then again, we'll finish up by answering questions on Zoom. Okay, so Dr. E stepped away. Did you mention in your story what caused your Graves' disease trigger, or if you still have to deal with Lyme disease? So Lyme, so Graves is pretty much gone. I mean, it's been a remission. I hate saying the word cure because there's always the chance, I'm sure it could come back. But and I know stress was huge. My adrenals were, in really bad shape. But Lyme, so chronic Lyme, I was diagnosed in 2018. I'm pretty sure it's not gone. If I didn't know I was diagnosed with Lyme, I probably, like most of the time, I feel like I don't have Lyme, but sometimes I do feel weird symptoms, and I can't, like when I tested positive for chronic Lyme, and then I retested, like I guess it was maybe like 6 or 8 months later, and it was still positive. And, from what I understand, you can't really, and I could be wrong, if anybody has gotten rid of chronic Lyme where it's actually negative, like it was positive and then it was negative, definitely let me know. But, from what I understand, once you have it, either you can't get rid of it or it's very difficult to get rid of. But again, with me, I can't say that I ever tested negative for chronic Lyme since I've been positive, but I'm feeling pretty good. I didn't have really bad symptoms in the first place with chronic Lyme. I had more neurological symptoms, like a lot of people have like really debilitating fatigue and a lot of pain. So I had some not real bad pain, but like shocking sensations. And sometimes it would wake up in the middle of the night with like muscle cramps and the shocks, and had some weakness in the leg, which was really scary. But I haven't experienced, so knock on wood, haven't experienced those symptoms in over 2 years. So again, sometimes I do have some weird symptoms, like the weakness in the leg I haven't had, but the regular consistent symptoms. And when I have weird symptoms, I don't know for sure if they're Lyme, but I'm assuming that's just symptoms that sometimes you see those weird symptoms with these stealth infections. So yeah, the Lyme, I would say, I'm guessing is still in me, but I'm keeping it under control, just trying to keep my immune system healthy. But the Graves, of course, trying to do, I mean, I'm not perfect, I will admit that, which hopefully gives people hope that you don't have to be perfect for the rest of your life. I definitely eat healthy most of the time, but I can't say I've been, 100%, like, I mean, as far as, whole food, healthy foods, organic, that's mainly my diet, but I can't say I haven't strayed at times. And, stress has definitely been better, stress management, making sure I'm getting sufficient sleep. And yeah, so Nessa here says, I have Graves. I had no symptoms after having both Pfizer vaccinations. Yeah. And again, I've seen that, I've seen that in the Facebook group from a number of people. What I'm interested in seeing, because you can't always go by symptoms, I'd like to see like the pre and post antibodies, like antibodies before the vaccine, and then antibodies not only right after the vaccinations, but like maybe like a few months after, and especially like someone who is in remission. Again, I'm in remission, but I honestly don't plan on getting the vaccine anytime soon, and maybe not at all. But but maybe others who are thinking about getting the vaccine, and after they've been in remission, it'll be interesting to see. So, all right, so I'm a healthcare worker who's been diagnosed with Graves since February 2021. I received both doses of the Moderna vaccine due to my job. I need to take my temperature at work every day. Since my second dose, my body temperature has increased by 0.3 to 0.4 degrees on a consistent basis. I used to have a 26-day cycle. Now my periods are 2 to 3 days early ever since the second dose. Reports of early cycles have also been found in Israel and the US. In the US, a small percentage of women are also experiencing later cycles and heavier periods. I've also found menstrual irregularities in some of my patients as well. Oh, interesting. So thanks for sharing, Jeanette. Yeah, like I said, my big concern is, I mean, I'm concerned also short-term effects, but long-term effects as well is a concern as well. So I don't tell my patients, I don't tell anybody to get the vaccine or not to get the vaccine. Like, I share my experience and what my thoughts are, but I never tell people not to, not to get it. That's, completely up to the person. And again, I've had family members, my parents have gotten it. My younger sister has gotten it. I didn't tell them to get it, but that was up to them. But, same thing with my patients. I don't tell anybody to get it or not to get it. But in my, I'm just, again, to me, it's a newer vaccine, and interested to see, for those who have gotten it, what, how people do. So, all right. So let's see, the Foster's T3 levels are at 4.69. How long does it take to normalize T3 levels? T4 levels are normal. I mean, good news, T4 levels are normal. So, assuming things are heading in the right direction, I would, everybody's different. I would hope within a few months, and if T3 levels are high, TSH probably is still on the lower side. So it might take even longer, probably will take even longer for TSH to increase, but hopefully not too long. But again, I can't predict. It might take 6 months, but hopefully more like a couple of months, more like 2 or 3 months, and maybe even sooner, maybe even like a month. But all right, Hassan says hello, and Ivy, good day, doctor, good day to you as well. And so Hassan says my thyroid globulin is a little high, 10.1, TSH 5.4. Or 5.44, T4 normal, very tired. So yeah, it looks like Hashimoto's with elevated TSH, thyroglobulin antibodies high, T4 normal. But again, did they test T3? Because first of all, T4 normal, again, is it within the normal, is it within the optimal range, or is it, and I wrote an article on that too. So if you visit my website, I wrote an article like on thyroid blood chemistry in 2019, where I give like the optimal ranges and the lab reference ranges. So it might be within the lab. I mean, the TSH obviously is high, 5.44. And even though I've seen TSHs that are way higher than that, but still 5.44 is high. T4 might be within the normal lab range, but maybe less than optimal. And it looks like they might have not tested T3, which is the active form of thyroid hormone. So you're very tired, which again, and it could be other things. A lot of things can cause fatigue as well, such as problems with adrenals. And you mentioned iron absorption. Iron absorption was low last time I checked, and then taking thyroid hormone replacement. So it's, thyroid hormone replacement might be helping. But if you're taking T4 and you do have a problem converting T4 into T3, then like levothyroxine is not going to help with the conversion problem. But again, there could be other factors like the iron, low iron, problems with adrenals, problem with other nutrients, even like chronic infections. All right, so Ivy here. I was diagnosed with thyroid issues, had checked with my blood and scanned my goiter, and had a last FNAC biopsy. My thyroid doctor said no worries, and the result of the biopsy is benign. I have nodules too. My concern is I always feel tired, and I also have low iron. Is there a connection with my thyroid? Actually, iron is important for thyroid hormone production. There is a connection. It's important for the thyroid peroxidase, which thyroid peroxidase is an enzyme important in the manufacture of thyroid hormone. So when you have thyroid peroxidase antibodies, that means the immune system is causing damage to that enzymatic process. And so you're always feeling tired. Again, it could be low iron. It could be, so you didn't say like if you're low, like your thyroid is low. I mean, again, a lot of things can cause low, low energy, like always feeling tired. So low iron, low B12, again, low adrenals, low thyroid hormone levels, stealth infections like Epstein-Barr, for example, Lyme, even though, again, my experience, I didn't experience severe fatigue, but all right, my doc didn't give me medication. Is that okay? It depends. I mean, not everybody needs to take medication, but if the thyroid hormone levels are really low, then maybe, then yeah, I would say if it's on the lower side of optimal or definitely overtly hypo, then probably a good idea. But it really depends on your lab. So my guess is, your TSH probably was within at least the lab range, because they usually go by the TSH, even though I don't necessarily agree with that. But that's what many doctors do, is go by the TSH. And yeah, so but yeah, it really depends on it depends on thyroid panel, but then your symptoms too. Like if someone has a TSH of like 3.5, that's within the lab range, but it's greater than optimal. And if someone's symptomatic, they might feel better with thyroid hormone replacement, but there could be other factors as well, such as, again, problems with adrenals. All right. It says drinking wine or alcoholic beverages affect thyroid with Hashimoto's. I mean, it affects the gut, which Hashimoto's, again, autoimmune. Most of the immune system cells are in the gut. So I definitely would be, cautious about drinking alcohol. I mean, some people might be able to get away with drinking, some red wine every now and then. If you're doing that, make sure it's organic. but yeah, I do recommend avoiding alcoholic beverages, ideally, while healing. All right, so we're going to get back to Zoom for the last 10 minutes. And again, I apologize. I definitely won't get to everybody's questions. But like I said, if you trickled in late, I will almost definitely be doing a 5-day challenge the week of May 17th, which, hard to believe, it's almost May. So I guess that would be 3.5 weeks away. And then I probably will do at least one more of these before that challenge. But during the challenge, I do these calls. And again, so the goal during that challenge would be to try to get to everybody's at least most important questions. People never run out of questions, so I can't say I'll get to everyone's questions because people keep on thinking of questions, which is great. I mean, it's like I said, no complaints. Just in here for even an hour and a half, it's hard to get to everyone's questions. But let's see. So we have someone from Ohio, and then Patrice says, can you say if it would be wise to begin the thyroid calm supplement while on methimazole? Can one transition to just thyroid calm fairly quickly? I have had patients on, so thyroid calm, for those who don't know what thyroid calm is, it's an herb for hyperthyroidism. It's a supplement that has bugleweed, motherwort, lemon balm. And I have had patients take anti-thyroid medication such as methimazole and the herbs with the goal trying to, again, I can't tell them to stop taking the methimazole, but the goal is if you're taking both, it might push you towards the hypo side a little bit quicker, and then the prescribing doctor could decrease the dose of the methimazole. So you're relying more on the herbs. And, so some people can transition quickly, but usually it is a slower process because usually the only way to know if it's working, I mean, you could tell by symptoms. I shouldn't say the only way to know, but really the only way to know is by looking at a follow-up thyroid panel. And I will say thyroid calming formula, good quality, but a lower potency. So and I'm not saying you need a higher potency. It depends. Some people do fine with the thyroid calming formula, but I wouldn't say fairly quickly. Like it might be a few month process possibly. All right, so Wendy here, I have a thyroid nodule and was told by functional medicine doctors to avoid iodine. Can iodine cause nodules? Also was diagnosed by a different doctor with Graves and Hashimoto's. How can you have both? So I mentioned earlier, it is possible to have antibodies for both Graves and Hashimoto's. Doesn't mean you're hyper and hypo at the same time. But then, what was I going to say? Iodine in some cases can actually, like an iodine deficiency can be a factor. Like if someone a cause of thyroid nodules could be iodine deficiency, but in some cases iodine could worsen thyroid nodules. So if someone has like toxic multinodular goiter, in some situations, iodine is very controversial. So I definitely wouldn't say I've had a good experience with iodine in the past, but I can't say I recommend for my patients across the board to take iodine just because it's unpredictable. But iodine sometimes can help with nodules, like can help shrink them, but sometimes they could actually increase it, especially with like toxic, some cases, not all cases, some cases with toxic multinodular goiter, they might have an iodine deficiency, but some cases it could make things worse. So you definitely want to be careful. And yeah, and then I mentioned about the Graves and Hashimoto's antibodies. All right, it looks like Jacqueline would love to connect with Maggie. All right. And Cheryl says, I'm on NP thyroid and asking about estrogen and progesterone, which are being low, but testosterone is high. So again, if you have too high, I mean, when testosterone is high, it could also be like insulin resistance. So we see that especially with like, PCOS, but even in the absence of PCOS, polycystic ovarian syndrome, if someone's having problems with detoxifying there's like estrogen metabolism, like I mentioned that, which is essentially detoxifying the estrogens, but with all hormones, you have to detoxify. So that could be also a reason why testosterone is high. All right, so Rojo here says, Dr. Osansky, I brought my Hashimoto's into remission by reading your book on Hashimoto's triggers, along with books by Dr. David Brownstein. Very, very cool. So I used the AIP, lots of supplements, and about 50 milligrams a day of Lugol's iodine. So another controversial iodine. After getting a bunch of x-rays, my face started burning, and I took 3 drops of SSKI, so 3 drops of potassium iodide, which is about 150 to 180 milligrams. Almost immediately, I started to feel my thyroid nodule to the point of discomfort and almost pain. And I've had sensations there ever since. Is it possible that potassium iodide will harm my thyroid, whereas Lugol seems to be tolerated? Please explain how iodine might damage the thyroid. So iodine, again, it is complex. I've had a positive experience with iodine, but I've known a lot of people who have not had a positive experience. And and again, Lugol's, there are some people that even with Lugol's, it doesn't, they don't do, some people with Lugol's, it can cause trouble. So iodine, I have not seen it where it really damages the thyroid directly. Now it can, in some cases, induce hyperthyroidism, even though it can also do the opposite. If someone has hyperthyroidism, taking higher doses of iodine can sometimes actually lower thyroid hormone levels, have an opposite effect. But the way it seems, like I wrote, you read my book, Hashimoto's Trigger. So one of the triggers I put down is iodine. Even though I had a good experience with iodine, I actually brought it up as a trigger in my Hashimoto's Triggers book. And that's how it could potentially affect the immune system, be an immune system trigger, an autoimmune trigger, which in turn affects the thyroid. So I don't know where, other than maybe, again, causing hyperthyroidism, but not really causing damage in that respect. But yeah, so I don't know about it affecting, like causing not causing nodules, but again, I give the example where sometimes some of the research shows where it could actually cause existing nodules to grow, like to get bigger potentially, but then there's some evidence where it shows that it could actually help to shrink nodules. So, and you don't really know until, I mean, anybody, I will say this, and you also read Dr. Brownstein's book, anybody who takes iodine, they want to test for iodine first, do urinary iodine test. But even if it's deficient, some people still don't do well. So it really, yeah, iodine, it's definitely complex. So, and maybe I'll talk more about it during the challenge. But so Zanetta says, can you talk about ear pain and hyperthyroidism? Can it be a symptom? I mean, I suppose it could be. I can't say that it's a common symptom. That I mentioned earlier, I had ringing in my ears, some tinnitus when I was dealing with hyperthyroidism, Graves' disease, and it was temporary, only a few months. But ear pain, I can't say is common with hyperthyroidism. So I guess it's possible it could be a symptom. I mean, again, there's classic symptoms like elevated resting heart rate, heart palpitations, increased appetite, weight loss, loose stools. But, not everybody experiences classic symptoms. Some people experience weight gain. Some people experience, skin conditions, I would say, are pretty common with like Graves, more related to the immune system. But yeah, ear pain, not a common symptom, but maybe it is. I mean, if the hyperthyroidism is resolved, hopefully you're doing something, either the antithyroid medication or antithyroid herbs. And if the thyroid hormone levels are imbalanced and the ear pain goes away, then there obviously was a relationship. But if not, then it sounds like there might be something else going on. All right, so Sabrina, hello, Dr. Eric. Thank you so much for your webinar. I have 2 questions. So I'll try it depends how long, because again, it's 3. I'm just about done here, but I'll answer a few more questions. So I have 2 questions. In my GI map test result, H. pylori number is high, but all virulence factors are negative. Would it still be a trigger for Hashimoto's and cause joint pain? So it could still be a trigger with GI map, even if the virulence factors are negative. If H. pylori is high, yeah, it still could be a trigger. It may be causing a joint pain. It's not a common effect of H. pylori, so there might be something else. Um, so yeah, the second, as far as joint pains, I'm not sure. And then besides GI map tests, what blood tests and breath tests, or will blood tests and breath tests be useful to show the presence of H. pylori? Blood tests, the problem with it is looking at antibodies, and the antibodies can remain in the blood for quite a long time. And, so breath tests, yeah, if someone's doing a follow-up test. Now, the thing is, though, the GI map is supposed to be more sensitive because it's looking at the DNA. It's using, special type of PCR, like quantitative PCR testing. So it's supposed to be even more accurate than the breath test. Now, of course, they're going to say that because it's their test. But I have seen people where they have negative breath tests and a positive GI map. Now does that mean it's a false negative breath test or a false positive GI map? I'm not sure, but it makes sense if the GI map is using DNA testing that it would be more sensitive. But that's a challenge. If you do follow up with the breath test, a negative result might not rule out H. pylori. I will say one other thing with the GI map, you could test H. pylori separately if you don't want to do the whole GI map. All right, so let me see if there's anybody that rings a bell where I haven't gotten in. So Bernadette, I don't think I answered your question. So taking methimazole for hyperthyroidism, allergic to contrast dye, iodine. Doctor wants me to take radioactive iodine. Can I? Yeah, that's a good question. I'm not sure. So if you're thinking, I will say this anyway. If you're thinking about radioactive iodine, I wrote a recent blog post a few months ago. I think it was this year, either that or late 2020 or early 2019, early 2021, about 3 reasons to avoid radioactive iodine. So read that. You might, if you're absolutely going to take a conventional treatment method, you might want to consider surgery over radioactive iodine, especially with, you're being allergic to contrast dye iodine. But yeah, anyway, there's a few different reasons that I've given that blog post. It's also low dose methimazole, which isn't a cure, but neither is, radioactive iodine, they'll talk about being a cure because you won't be hyper. But look, again, it could be a challenge deciding between, hopefully you've tried some things naturally as well, Bernadette. If not, maybe again, check out my website and see, maybe look into addressing the cause of the problem. But again, if you're pretty much deciding, if you're sure that you're going to choose radioactive iodine or surgery, definitely check out that blog post. All right, let's all right, so Judy, so joining late, my last lab test showed a high reverse T3, 29.8, and still low TSH, 0.241, and thyroid stimulating immunoglobulins above 4.23. Am I still typical Hashimoto's with both numbers like this? I mean, it would seem more hyper. I mean, so TSI, is elevated, so that's the Graves' disease antibodies. TSH is low. With Graves, many times it's undetectable, so yours is detectable. But hypothyroid and Hashimoto's TSH is usually high. If you were taking like thyroid hormone, like levothyroxine or natural desiccated thyroid, that could lower TSH. But if you're not taking anything, then low TSH, I mentioned reverse T3 is commonly high with hyperthyroidism. Again, but the TSI definitely indicates that those antibodies for Graves. Recently have had more heart racing, and I'm treating with, okay, so you're treating with buckwheat and lemon balm, how to balance this more, found out I had a tooth infection, and that could be a factor. I mean, oral health is important. So you're taking bugleweed. So if you weren't taking the bugleweed, the TSH might even be higher. And yes, I don't know if you've done a like recent thyroid panel looking at T3, T4, but it sounds like those might be high. But again, maybe not if you're taking a bugleweed. So if you're taking a bugleweed and TSH is not undetectable, maybe thyroid hormones look good. But either way, immune, again, sometimes it is challenging to find the triggers. But if those antibodies still elevated, that means that there's still something missing. And again, maybe the fingers crossed that it's a tooth infection. Definitely consider, I assume you're seeing a dentist, hopefully a biological dentist, someone who's, just gonna, like, again, just more of a functional medicine practitioner, so rather than a conventional dentist. All right, so Kathy, I don't think I've gotten to your question. So dropping gluten and dairy and taking a thyroid and adrenal supplement got my TSH from 11.76 to 2.8. My antibodies dropped from 2 to 1. My 2 from 48 to 38. I don't know what that other one is. From 40, do you have any additional suggestions to get that 38 down, or is it time? So you talk about, I assume, another type of antibody. So you have two types of antibodies. Maybe thyroglobulin antibodies drop from 2 to 1, and maybe TPO from 48 to 38, which is not terribly high, but still above range. And it could take time, but it also could be that you still have some detective work to do to find the triggers and underlying imbalances. All right, so Thana, hi, Dr. Eric. Thank you for an insightful webinar. I have Hashimoto's for 7 years now and on Synthroid 75, which from the lab standpoint manages my hormones well, but from physical, I don't feel great. Always fatigued. What ideas do you have to make me feel good? Also, does diets gluten-free? Yeah, so gluten-free, yeah, endocrinologists won't recommend a gluten-free diet, but yes, I would recommend gluten-free diet. I would recommend maybe consider, I mean, you have Hashimoto's. Again, check out my book, Hashimoto's Triggers. You could get the Kindle version for $6 if you want the hardcover, or not hard. Well, it's the paperback. It's, I think, like $20 or $18. Very comprehensive book to look into trying to find your triggers. Again, you might have problems more with T3. Synthroid is synthetic T4. So looking into T3, making sure they test for T3, but there could be low nutrients such as iron, B12, low adrenals could also be a factor. Again, I talk about all this in my book. Also my website, naturalendocrinesolutions.com. I talk a lot about this as well. But yeah, so make sure a thyroid, they look at T3, which is the active form of thyroid hormone, adrenals, nutrients. Again, there could be other things. I mentioned stealth infections earlier. All right. Okay, need a Pfizer, on a Pfizer clinical trial, and I recently asked if I need to report my thyroid condition. They said I will need to report it at my next visit in 4 months. Okay, cool. All right. Yeah, so, all right, Monica, I was diagnosed with Graves last summer. My latest tests are TSH 0.27, reverse T3 29, TPO 150, T4 11.6, free T4 1.2, free T3 2.6, total T3 11.5, thyroid globulin antibodies less than 1. What are your thoughts on my numbers? So TSH is on the lower side, reverse T3 is on the higher side. You have the elevated TPO antibodies. So assuming these are the lab reference ranges I'm used to, T4 may be on the higher side, but it depends on what the ranges they use. Free T4, according to the most lab ranges, would be actually a really good range. Free T3, maybe a little bit less than optimal, but within the lab range. And total T3 looking okay, thyroid globulin antibodies negative. So thyroid, again, doesn't, if anything, maybe a little bit on the hypo side from a thyroid standpoint, but I wouldn't say hypo. Your T3 a little bit less than optimal, even though and I don't know if you're taking anything, but your TSH not showing that you're hypo. TSH is again on the lower side of 0.27. So again, might need more information, but TPO antibodies, I mean, we know that's elevated. So again, and okay, you were diagnosed with Graves last summer. So TSH. So again, numbers for Graves, numbers are looking pretty good. And even though TSH is a little bit low, but it takes some time for TSH to increase once, free T4, free T3 is normal. Reverse T3, common with hyperthyroidism, even though you're not hyper. So maybe it's because your T3, you might have a little bit of a problem converting T4 to T3. So I mentioned like liver, gut, adrenals, and those three also could help greatly with the TPO antibodies. So definitely would look into addressing those. And all right, so hopefully, I have one comment here, like towards the end, that my audio is very raspy and garbled, getting worse. Audio is totally garbled, but so hopefully that's not the case. But I guess we'll listen to the audio, and if there's a problem, we'll try to just use it anyway. So someone else says the audio is fine. Okay, so great. Thanks, Sarah. So all right, I am going to end it. I apologize for not getting to everyone's questions. I tried to get to everyone at least once, but I know I didn't get to everyone at least once. Like I said, I will have the challenge is almost definite, like 80-85%, probably closer to 90%. And that'll be the week of May 17th is when I plan it. And I'll try to have at least one more of these before then. So next week, I'll be back on Facebook interviewing an ophthalmologist on alternative treatments. And so check that out if you're dealing with thyroid eye disease. And again, then maybe either the week after or the week after that, I'll consider doing another Zoom to either Facebook or to YouTube. But again, hope everyone, thank you for your questions. Thank you for attending. If you didn't get your question answered, also, if you're still tuning in and you haven't had your any questions answered, get on early next time. That's the key. Just try to get on early, and then within the first few minutes, start typing in your question. Because when I first came on, I said, let me know where you're zooming from, and then also feel free to start typing your question. So next time I do this, make sure you again just try to show up earlier when it starts, as well as asking your questions sooner than later. But again, thank you for attending. Hope everyone has a good rest of your Friday. And I know some of you in Europe, it's later in the day, so good evening. Great weekend ahead. Enjoy your Saturday and Sunday. And again, hope to catch some of you maybe next week, and others hopefully at the free 5-day challenge I most likely will be having. All right. Take care, everyone. And again, thank you for attending.